Have you ever wondered why rates of sexually transmitted infections, or STIs, are on the rise among men who have sex with men? It's a pressing issue that's been gaining attention, with a clear need for innovative solutions. Enter the ANRS-IPERGAY trial, an intriguing study conducted in France. It aimed to explore whether a strategy called post-exposure prophylaxis, or PEP for short, using the antibiotic doxycycline, could potentially reduce the incidence of STIs among this population. Let's dive into the specifics of this trial and its enlightening findings. The ANRS-IPERGAY trial conducted in France involved men aged 18 years and older, who were having condomless sex with men and using pre-exposure prophylaxis for HIV. The trial was an open-label randomized study, meaning the participants knew the treatment they were receiving. This study was a follow-up to the original ANRS-IPERGAY trial, and the goal was to determine if post-exposure prophylaxis, or PEP, with a drug called doxycycline, could reduce the incidence of sexually transmitted infection, also known as STIs. The participants in the trial were randomly assigned to take a single oral dose of 200 milligrams of doxycycline PEP within 24 hours after sex, or they received no prophylaxis. The primary endpoint, or main result being measured, was the occurrence of a first STI, specifically gonorrhea, chlamydia, or syphilis, during the 10-month follow-up period. To measure this, the researchers used the Kaplan-Meier method to estimate the cumulative probability of the occurrence of the primary endpoint in each group, and compared this with the log-rank test. This trial was conducted on the intention-to-treat population, which included all randomized participants. All participants, regardless of their randomization, received risk reduction counseling and condoms, and were tested regularly for HIV. This comprehensive approach to sexual health was a key aspect of the trial. The results of this trial were quite revealing. Let's take a closer look. The trial found that doxycycline PEP does indeed have a significant impact on the incidence of STIs. Let's delve into the specifics. Between July of 2015 and January of 2016, 232 participants were randomly assigned to two groups. Half of them were given doxycycline PEP after sexual activity, while the other half were not. During the follow-up period, which lasted for a median of 8.7 months, 73 participants presented with a new STI. Of these, 28 were in the PEP group, while 45 were in the no PEP group. Now this is where it gets interesting. The occurrence of a first STI in participants taking PEP was significantly lower than in those not taking PEP. This reduction was particularly noticeable for chlamydia and syphilis, with hazard ratios of 0.30 and 0.27 respectively. However, the results did not differ significantly for gonorrhea. Adding to the intrigue, no HIV seroconversion was observed during the trial. Furthermore, the majority of STIs detected were asymptomatic, making up 71% of all 102 STIs. The results of this trial provide strong evidence that doxycycline PEP can play a crucial role in reducing the incidence of certain STIs among high-risk men who have sex with men. The implications of these findings are profound. The ANRS-IPERGAY trial has shown that doxycycline PEP can reduce the occurrence of bacterial STIs in high-risk men who have sex with men. This is a significant step forward in public health and STI management. Despite the promising results, it's important to note that the PEP group did report a higher rate of gastrointestinal adverse events, although serious adverse events were similar across both groups. While further research is needed, this trial has opened up new possibilities in the fight against STIs.